Hi, my name is Angelica Adcock, and I work at Chestnut Health Systems in Bloomington, Illinois. I'm coming on the ROSC channel to talk about medication management and also some kind of tips and tricks I have for you. Before we jump into this, make sure to like and subscribe so you can see more content revolving recovery. The first tip I have for you today is to get generic medication whenever possible. If you don't know the definition of generic medication, I will explain that now. Generic medication is a pharmaceutical drug that contains the same chemical substance as the drug that's originally protected by chemical patents. Generic drugs are allowed for sale after patents expire from the original drugs. Patents expire after 20 years. So generic medication has the same active ingredients as a lot of name brand stuff. Like for myself, I take fluoxetine, but the name brand for that is called Prozac. Generic medication often costs 40 to 60% less than name brand medications. In fact, they make up about 80% of medications that are being prescribed now. Lower cost generic medications have been shown to increase the likelihood that patients take essential medications prescribed by their doctors, and it actually improves patient health outcomes. Another good thing about generic medication is that insurances are more likely to cover these medications. Obviously, it might vary depending on what coverage you have. Make sure to check. So the next time you go to the doctor, or if you need to refill on your prescription, ask your doctor or the pharmacist if you can get a generic version of your medication so you can save some money. The next tips may be helpful for people that don't have insurance, but then also can be helpful for people that are on a budget. If you're not familiar with this website already, it's called GoodRx. And then they also have an app. If you have a smartphone, you can check it out there. On that app or website, you can compare prescription prices and save instantly with the free coupon. So like I mentioned earlier, I'm on fluoxetine. So if I was interested in seeing where I can get this medication at the cheapest price, I can type that into the search bar and then see what pharmacies are by me, and then I can see what location has the cheapest price. They also have this instant coupon you can use if you don't have insurance, or if insurance is not covering your medication, it can take a big chunk off of that bill. Walmart actually has a list of medications that they supply for $4, which is a 30-day supply, and then they also have $10 for a 90-day supply. This channel revolves around recovery, so just for the sake of this video, I'll be mentioning like the mental health prescriptions. But if you go through on this website, you can specifically look at all medications, and then you can click mental health medications, and you kind of scroll through and see what medications you can get for $4. And this is going to be especially important for people that are on medications that are on a budget. Some things that aren't really money related that I think are important to medication management are mail-in prescriptions. I don't know about you, but I tend to pick up my prescriptions like right before I run out instead of like a couple days before to be safe. But a lot of pharmacies are starting to do delivery and mail-in orders. So I know CVS started doing like a delivery service. I think you might have to pay like a subscription fee, and I believe Walgreens does this as well. But if you are shopping with a smaller pharmacy in your area, or kind of like a local pharmacy, they may offer delivery. So definitely check that out if you are someone like me that picks up medication at the last second. Another thing that is so important with medication management is timing, especially if you're someone that needs to take pills right in the morning, or someone that takes medication throughout the day. Like for myself, I take medication in the morning as well as right before I go to bed. So I have a smartphone, so I'm able to set an alarm clock so I know exactly when to take my medications in the morning and the night. But if you're someone that does not have a smartphone, there are these timer caps that you can buy online to put on your medication, and then you set it for a certain time, and it will ring during that time, so you just have a reminder that it's time to take the medication. And this one might kind of seem more obvious or self-explanatory, but pill organization is also important. I just have one of those like weekly pill organizers, but if you're someone that tends to struggle with refilling those organizers every time the week is up, you can actually get monthly medication organizers. So if you can invest the money, I would definitely recommend that, just because you can have everything set up for the month and you only have to do it once a month instead of every single week. And the last tip and trick I have for you today is a pill cutter. Sometimes we are prescribed medication that isn't the full dosage. Like sometimes medication only comes in 10 milligrams, but then you are prescribed 15. So sometimes you might have to cut a pill in half so you can take the right dosage. And I don't know if you've ever tried to do that with a butter knife, but sometimes it is very hard and the pill kind of slips around and jumps everywhere. But if you can get a pill cutter, those are really efficient and you don't have to hassle as much. You just put the pill in the thing and it chops it for you. So those are all the tips and tricks I have for you today. Make sure to like and subscribe to stay tuned on the ROSC YouTube channel and see what other content we have coming up. If you have any video recommendations, please make sure to leave them down in the comments below because we'd love to create some content that you're interested in. Thank you so much. Have a great day.